Arushi Agarwal. That's it. Dr. Arushi Agarwal will be presenting on a review of treatment modalities in choroidal hemangioma in our experience.
Good evening, judges and everyone present. I'll be presenting choroidal hemangioma, our experience. So, choroidal hemangioma is a rare benign vascular tumor which is a hematoma that is present since birth, and it is composed of tissue elements that are normally found in a given location. Cavernous type being the most common, followed by mixed and then capillary. It can be a circumscribed tumor or a diffuse cavernous hemangioma, and asymptomatic tumors require no treatment. But tumors with subretinal fluid threatening the macula, exudative retinal detachments are the ones that require treatment, and long-standing retinal detachment can lead to poor outcomes. So the various treatment options available are photodynamic therapy, transpupillary thermotherapy, anti-VEGF agents, and radiotherapy either in the form of plaque or external beam radiotherapy. Due to rarity of this condition, a small series needs documentation to understand the extent of the existing diversity. So ours was a retrospective study where we analyzed 5 cases of choroidal hemangioma who presented to the retina clinic of our institute. The age group ranged from 20 years to 65 with a mean of 39 and a male to female ratio of 4:1. The mean baseline vision was a logMAR of 1.76 and a final mean was a logMAR 1.1. The mean tumor height was 4 millimeters. Single treatment session was given to 3 patients and 2 of them required multiple sessions. We used triple T in 1 patient, PDT in 2, brachytherapy in 2, and external beam radiotherapy was used in 1 patient. So our first case was a 55-year-old man who presented with metamorphopsia and decreased vision with a presenting visual acuity of logMAR 0.5. We went ahead giving PDT with verteporfin, and after full fluence of PDT, we were able to achieve a logMAR of 0. The second patient was a 40-year-old male, but when he presented, PDT was not an available option, so we went ahead with iodine-125 brachytherapy. 30 gyri was delivered to the apex. Post brachytherapy, disc pallor was present, and we can see that there was a reduction in the disc edema, and the final visual acuity was logMAR of 1.2. The third was a case of a 20-year-old boy with diffuse choroidal hemangioma, a known case of Sturge-Weber syndrome. He presented in his left eye with a visual acuity of hand motion close to face. We went ahead with an iodine-125 brachytherapy. Post brachytherapy, there was a reduction of edema, and the final visual acuity was the same as the presenting. This same boy developed choroidal hemangioma in his other eye with the fluid present. So first we planned the patient with propranolol for 3 months, followed by full fluence PDT, and we gave an anti-VEGF agent Razumab. But unfortunately, the patient presented with a recurrence 6 months after, and we delivered fractionated EBRT. A total dose of 20 gyri was routinely delivered, and the choroidal irradiation was done using a lens sparing technique. Our fifth case was a 65-year-old female who presented with decreased activity. The fundus photo and the ICG of the patient shown. There was a subretinal detachment present, and ICG shows a lacy hypersynance with late without. Finally, after 3 treatment sessions of triple T, we were able to achieve a visual acuity of 20/40 and a reduction in edema. So, discussion comes that the macular circumscribed tumors, PDT, give us the best anatomical as well as the functional outcome. However, the limitation being that in the current practice is the non-availability. Extrafoveal tumors, triple T is the tool of choice. Multiple settings are required, and we need to closely follow up these patients as edema can recur. Radiation is coming up in a big way for management of these tumors. Plaque brachytherapy is there, and in cases of refractory and diffuse tumors, fractionated EBRT can help us attain an anatomical reduction. So this tumor can have diverse clinical presentation, and the treatment needs to be customized for each patient. PDT appears to be an excellent modality for the macular tumors. Propranolol, anti-VEGF, triple T, I have a definitive role to play in the choroidal hemangioma treatment, and fractionated is considered for diffuse as well as refractory cases. Thank you.
Only one was diffuse, others were circumscribed, right?
So the same boy had diffuse in both his eyes.
Okay, that are 2 numbers.
Yes, sir.
Okay, so they had this EBRT and...
so we tried multiple modalities, propranolol, anti-VEGF, and finally EBRT in one eye.
That was Sturge-Weber case?
Yes, sir.